technical reports and is a specialist when it comes to the American presidency and local and regional politics. He's also co-authored 2 books, one of which is The Politics of Disenchantment, and the other one being New Verdicts. And we've been talking about the impeachment trial at the Senate. Dr. Rosenberg, first of all, you appear to be too relaxed for a man as busy as you are, but we thank you for spending time with us today, and we look forward to talking to you further as we consider politics.
It was great speaking to you, and I hope your audience gained something from our conversation today.
Always, sir, always. Have a pleasant evening, and thank you so much for your time.
Okay, bye-bye.
Don't miss
Evening Words
with Nick Taliaferro.
Monday through Thursday, 4 p.m. till 7 p.m. right here on WURD Radio. You've been listening to the best of WURD Radio.
One more step. You got it.
You're doing great. This is the sound of a nationally ranked top rehabilitation hospital, home to the largest collection of robotics in the United States, where we continually exceed patient expectations. Because no injury is too severe or too minor for our care.
There you go.
This is the sound of success. Moss Rehab. Challenge accepted.
Tune in to More Than That with Gia Peppers live this Sunday, February 28th at 2 p.m. on WURD Radio, 96.1 FM and 900 AM, or wherever you listen to podcasts. This episode of More Than That is sponsored by KRC Kroger Company, who is committed to becoming the most inclusive company in the world. Everybody in.
WURD Radio is independent black media.
And we're able to stay independent because of our 4WURD movement and members like you.
Treat yourself to the treat of buying a WURD membership. It's less than a quarter a day. That's less than a bag of chips. And we really, truly need to keep this platform going so that we can stay connected as we reimagine our community in 2021.
Start or renew your 4WURD membership today at wordradio.com/4WURD or call 215-425-7875. WURD Radio. Independent black media.
Celebrating black history all year long. Fannie Lou Hamer.
We are sick and tired of being sick and tired.
This is WURD Radio, 96.1 FM
And 900 AM WURD.
Philadelphia, independent black media. The views and opinions expressed by the guests, listeners, and hosts of any program on WURD Radio do not necessarily reflect those of ownership, management, or advertisers of this station. In the community
With Stacy Scott.
presented by Health Partners Foundation right now on WURD Radio
96.1 FM.
and 900 AM WURD.
Streaming live on wordradio.com.
The WURD Radio newsletter,
Keeping you informed, engaged, and connected.
sign up by visiting wordradio.com. Scroll to the bottom of the page and type your email address under Connect with Us. You'll receive the latest information on WURD Radio, messages from our president and CEO, Sarah Lomax Reese, exclusive articles and multimedia content, and resources.
Stay informed
with the WURD Radio newsletter.
Well, the kids are in bed. Time for a little grown-up quiet time.
What do you mean quiet time? It's your birthday.
We're about to party.
Haha, funny. It's gonna have to be a you and me party this year. You know we can't have anybody over.
Well, your mom and dad are coming from Florida. Sis will be here from California. Oh, and a couple of old friends from just about everywhere will be showing up. They should all be here about now.
COVID-19 has changed the way we do things, for now. But social distancing doesn't mean you can't be social. COVID-19 doesn't have to keep us apart. Friends and family are finding new ways to be together, especially with how hard it's hitting the Black community. Vaccines are here, but until enough of us are vaccinated, we still have to be down with slowing the spread. Keep a 6-foot distance, wear a mask, and avoid indoor social gatherings. Learn more about vaccines and slowing the spread at cdc.gov/coronavirus. Brought to you by the U.S. Department of Health and Human Services.
In the community
With Stacy Scott.
presented by Health Partners Foundation right now on WURD Radio
96.1 FM.
and 900 AM WURD.
Streaming live on WURDradio.com.
All right. Good afternoon, family, and welcome to In the Community with Stacy Scott. I'm your host, Stacy Scott, President and Executive Director of the Health Partners Foundation. And as always, our show today is brought to you by the Foundation, where we bring hope and healing to vulnerable populations one neighborhood at a time. We like to say that we're the philanthropic arm of Health Partners Plans, a state-funded insurance company, and we offer Medicaid, Medicare, and CHIP. And speaking of CHIP, it is short for Children's Health Insurance Program. Here in Pennsylvania, it's a program to provide health insurance to uninsured children and teens up to age 19 who are not eligible or enrolled in medical assistance or Medicaid. So it's not just for folks with a lower income. If you or someone you know is interested in learning more about CHIP, give Health Partners Plans a call at 1-888-888-1211. That's 888-888-1211. So today we're going to be talking about the COVID-19 vaccine. The vaccine is here. And I'm so happy to report that numbers are, in fact, going down. But even though that's the case, family, we have to remain vigilant. So please, please continue to wear your masks, wash your hands. And yes, while we are physically distant, yet let's remember to be socially responsible. I'd like to give a quick shout out to my super producer, Mike. Mike, how's it going?
It's going pretty good.
It's so good to hear you. I can barely hear you, though, Mike. You out there?
I'll try to keep it chill.
Oh, there you go. How you doing today?
I'm doing pretty good. There's a lot of technical stuff going on behind the scenes that a lot of people don't need to know about, but yeah.
That's okay. We're going to keep it moving, right?
There you go. That's it. That's how we do.
We're going to keep it moving. That's how we do. So there's a lot of talk out there in community, Mike. Should I or shouldn't I get the vaccine? Some folks are scared to get it.
I'm even questioning it.
You're questioning it, Mike? Really?
I just want to learn as much as I can. I don't want to jump into it, you know? I'm open. Okay. I just want to know. You know, I'm not one of those people that say, I'm not doing it. No, I'm a person, if I know everything about the vaccine and am confident enough to take it, then I will.
You know what? Then this is the show for you,
Mike.
There
you go.
Okay, this is the show for you. So just a little personal story real quick. I have some health challenges, and so I was eligible to be in that first group, that 1A group, and I did get my shot. You know, so far, no crazy side effects. My arm didn't fall off. I didn't grow a second head or anything like that. You know, I get my second shot next week. And Mike, did you see the movie? I mean, the musical Hamilton?
I did, yes.
So first of all, I love it. Can we just say that?
It is great.
Shout out to Manuel. It is amazing. I listen to the soundtrack all the time. Well, there's this song by Alexander Hamilton.
Yeah.
I'm not throwing away my shot. Can I tell you? I sing it all the time, and that's our theme for today, okay?
All right, I love it.
Don't throw away your shot, Mike, okay?
I got you.
All right.
See, that's why it's better coming from you.
Oh, well, I just want you to be safe, that's all. So that I can come back in the studio and give you a hug.
I know. It's been over a year now.
Too long, Mike.
Way too long.
It's been too long. So today our guests include Dr. Merlene Harris-Williams from HPP, Health Partners Plan. She's going to talk to us today about what HPP is doing to keep members safe, tested, and vaccinated. We're also going to hear from Cheryl Bedigal. Cheryl is the director of the Division of Chronic Disease and Injury Prevention for the city of Philadelphia. Her work is focused on reaching communities in the city that have been disproportionately affected by the virus and are in need of the vaccine. And then last, we're going to wrap things up with Beverly Donaldson. She is the executive director of the Neighbor to Neighbor CDC. She's going to talk to us about lessons she learned from hosting a community vaccine clinic. But our first guest is Dr. Merlene Harris-Williams. Dr. Merlene, are you with us?
Yes, I am. Thank you very much for having me on.
Hey, Dr. Merlene, how are you today?
Doing well, thank you.
Good. We like Mike said, we were having some technical difficulties, so let me take a step back and let me just introduce you properly. So Dr. Harris-Williams is a seasoned healthcare professional and has extensive experience in quality, utilization management, and disease and case management. In her role at HPP, she oversees the development and management of clinical strategies aimed at ensuring the highest quality care and best health outcomes for Health Partners Plans members. Dr. Merlene is a major contributor to the development of several of our quality programs, including our oral health initiatives, diabetes prevention programs, tobacco cessation, as well as a strategy to combat opioid misuse. So once again, we're going to welcome Dr. Merlene Harris-Williams to the show. Dr. Merlene, talk to us. What is going on at HPP with this vaccine?
So there's a lot going on with HPP at the vaccine. We're certainly very committed to the health and well-being of our members and our providers and the community we serve. I want to definitely talk about that, but I also can't leave with Mike.
You can talk about whatever you want.
Out there, everybody. It is so important that we get the vaccine. As you know, Black and brown folks, we are disproportionately affected by this COVID virus, and we're seeing a lot of deaths and hospitalizations because of that. So all of the things that we need to do in terms of social distancing, wearing our masks, and washing our hands are certainly important. But we definitely need to make sure that we get the vaccine, because that will help us not have the severity of the virus, and hopefully turn the tide around on these deaths that we're seeing. So get your vaccine. I got mine last week as well, Stacey, and I still have my arm and everything's doing fine.
Right.
But it's very, very important. And I know that there's a lot of mistrust in our community around the historical situations around the Tuskegee Institute experiment and Henrietta Lacks and things like that. But those were us not getting the treatment. But this here is treatment that gives us something in our armamentarium to help us. So I want to strongly encourage your audience to make sure that they are in line to get the vaccine and help them to combat this. But let me tell you about some of the things that Health Partners is doing. Like I said, we remain committed to the health and well-being of our members and our providers in the community that we serve. We have a multidisciplinary team that meets weekly to discuss the status of what's going on with COVID-19 and the vaccine. We have been partnering with our local, state, and federal partners to make sure that we're supporting them in resources in order to get the vaccine here. We have a website that we set up to make sure that we're communicating with our members. On the website is at www.healthpartners.com, our health and wellness page, and it has a host of a lot of good information on there. It really depends on the county, so we have links to the county of how you can get tested and the vaccines that when they become available. We've worked with some of our health providers, our large health systems, where we're supporting them as they're standing up the ability to do the vaccinations. We are working with just a whole host of things. We're working with the city. As you know, that they will be FEMA is coming into the city this week, and they're going to be standing up vaccinations, and we're working as partners with all the MCOs so that we're able to make sure that our members are getting vaccinated. So just a lot of activities, Stacey, around the work that we're doing at Health Partners.
Wonderful. I mean, one of the great things about our organization, Health Partners Plans, is that we've always really been committed to what's happening to the community, what's happening in the community. And we've always been committed to being right at the forefront, providing not only the information that folks need, but also access to great care. And even now with the vaccines, we're having conversations with a number of providers and organizations to set up vaccine clinics around the city. So to our listening audience, please, check out healthpartnersplans.com for more information. On the Health Partners Foundation website, I'm going to be posting information about vaccination sites, information about the vaccine itself, because we want people to be informed. Just like Mike was saying, he's like, he needs to get more information. So we want to make sure that Mike is an informed consumer and he
That's
gets
all I
the
require.
That's right, Mike, because we want to keep him we want to keep him safe. Dr. Merlin, what do you think about this? Go ahead. You go ahead.
The members can also call our member services as well. And
that's right.
We have people who are answering the phones to be able to give them information in addition to our webpage that we have available.
Right.
So, we also work with the pharmacies. As you know, the pharmacies have been the first line of where they're being distributing out the vaccine. So we have a good working relationship with our pharmacy CVS as well as the other pharmacies that are giving out the vaccine. It is just critical, Stacey, that our members understand the importance of getting the vaccine and that it really will help to make it so that the virus that they're either not getting the virus, or if they do, they don't have the severity of illness. I mean, as we stated already, Black and brown people are the ones who have suffered the most in terms of getting the virus, be it because of them being on the front line type workers that they do, or because they have risk factors, lung disease, heart disease, and diabetes, which puts you at risk for getting this disease. So it's really critical that we get this message out and that they know that we have resources at Health Partners to be able to help them with questions that they may have around the vaccine, around testing. Is the vaccine covered? Yes, the vaccine is covered. So there's no cost to our members for getting the vaccine.
That's right.
Mm-hmm.
That's right. And also, Dr. Merlin, you brought up a really good point. So there are some among us that do have some hesitancy around the vaccine, but also just around interactions with the health community in general. You brought up a couple of specific examples, the Tuskegee experiment, as well as Henrietta Lacks. I don't know if everyone knows about Miss Lacks' story, but she was an individual. She was an African-American woman. She had cancer. Johns Hopkins Hospital took samples of her cells without her permission, and then come to find out these cells kept reproducing. They never died, and went on to sell these cells all over the world, use them for all kinds of research, made billions and billions of dollars, and her family was never compensated. So certainly that's a story that's out there, along with the Tuskegee example, where individuals were not treated for syphilis, and some were, some weren't, and what happened with that. And there's, we have other stories in our communities of things that have happened to African Americans at the hands of the medical profession. So we understand why some may have some hesitancy, right? We understand it. We get it. But the message that you go ahead, Doctor.
No, I said we definitely understand that, and there is a mistrust there. However, our community definitely has to move away from that in terms of that's historical, and that during those times that was them withholding treatment for the Tuskegee experiment. Remember, that was for syphilis. They had the syphilis and they wouldn't give them the treatment. This is different in so much as on the vaccination, there is an African-American scientist, epidemiologist, who worked on this vaccine. There's been African Americans who participated in the trials. So it's not similar to before when things were withheld. It is now something that we can actually get to help us in terms of prevention. If we don't get in line and get these vaccines, then we're going to be have the situation where we're not going to be protected. So it's different.
That's right.
Do we have a honest distrust historically? I get that, and that did happen, and you do need to know your history. But we also need to be able to move forward and realize that this is different, and that this really is going to help us stay safe, help our community stay safe, and it is important that we turn the tides. What we do know is, Stacey, that when they gave out the phase 1 vaccine for the nursing home patients, we're seeing early studies now that their hospitalizations and deaths have decreased tremendously from this vaccine. So it's different in that. It's prevention. We have to get in line. So know your history, but also move forward.
That's right. That is excellent advice, Dr. Merlene. The other thing I would just add to that is, just as providers and individuals in the medical profession, we want to be careful, too, about spreading that narrative or repeating the narrative that Black folk don't want to get it, right? Because if we keep putting that out there and promoting that, what's going to happen, unfortunately, is many communities of color won't be able to have that access to it. And so our job today and at Health Partners Plans always is to enhance not only the health of our members, but also for individuals living in the communities where our members live. And so I just want to thank you so much and just give you the opportunities or anything else that you'd like to tell our listening audience, Dr. Merlene.
I'd just like to tell the audience that Health Partners just remains committed to our members, to our providers, to our community, and that we are a partnership. We are working with the local, state governments and supporting our providers to make sure that we are getting the resources and the help that our members need to get these vaccines, get the testing, and we're going to remain vigilant that for our members.
Well, thank you so much for joining us today, Dr. Merlene. And I also just want to say what a pleasure it is to work with you. I work with you on a number of initiatives at the plan, including your dental health initiatives. I want to remind everybody that February is National Children's Dental Health Month. And so please just be aware of our children's dental health needs. But Dr. Merlene, thank you so much. And we'll be chatting soon.
Thank you for having me.
All right, take care. So everybody, we're going to take a quick break, and on the other side, we're going to come back with Cheryl Bedigal, who's the Director of Division of Chronic Disease and Injury Prevention, and you are listening to In the Community with Stacey Scott.
These moments turn into memories, and I can feel you connect. Wonder if you'll remember me, 'cause easily I forget. Easily I to those memories when you feel like there's nothing left. I need you to remember me, 'cause easily I forget.
You're listening to WURD Radio, 96.1 FM and 900 AM WURD, independent Black media. Welcome back to In the Community with Stacey Scott, presented by Health Partners Foundation on WURD Radio, 96.1 FM and 900 AM WURD, streaming live on WURDradio.com.
And welcome back. You're listening to In the Community with Stacey Scott on WURD Radio, 96.1 FM, 900 AM. You can also listen live online at wordradio.com and by using the WURD WURD app. If you're just tuning in, we just wrapped up a conversation with Dr. Merlene Harris-Williams of HPP. And so she shared with us some of the things that HPP is doing to keep the community focused on safety. She talked about how we are providing information to our members and planning clinics. And it was a great conversation. But you know what, before we go on to our second guest, this is February, and as we wrap up so-called Black History Month, I thought I'd share a Black History fact with you. So today we're focusing on the COVID-19 vaccine, and Dr. Merlene kind of alluded to this, but did you know that it was a 34-year-old African-American doctor, female doctor, by the name of Kizzmekia Corbett? She was one of the primary scientists working directly to develop and produce the Moderna COVID-19 vaccine. So yes, this sister is helping to keep us all safe. When you get a chance, Google her. Her name is Dr. Kizzmekia. That's Kizzmekia Corbett. And she was one of the scientists working directly to develop and produce the Moderna COVID-19 vaccine. And incidentally, that's the vaccine that I have. So thank you, Dr. Corbett. All right. So our next guest is Cheryl Bedigal. Now, Dr. Cheryl Bedigal is the director of the Division of Chronic Disease and Injury Prevention and the Director for Health Equity for the Philadelphia Department of Public Health. She's a board-certified family physician and has previously served as the Chief Medical Officer of Complete Care Health Network, which is a federally qualified community migrant health center located in New Jersey, as a family physician and clinical director with the Philadelphia City Health Centers. And she saw patients there for over 12 years. She's also a past president of the National Physicians Alliance, now part of Doctors for America, where she helped develop physician teams focusing on gun violence prevention and drug safety and pricing, while continuing the organization's work on access to high-quality, affordable health care. Right now, her work is focusing on achieving health justice through policy, systems, and environmental approaches to the major drivers of poverty, health, or poor health in Philadelphia. So let's welcome Dr. Cheryl to the show. Doctor, are you there?
Pleasure to be here with you, Stacey.
All right. Dr. Cheryl, I need you to speak up just a little bit because I'm having a little trouble hearing you.
Sure thing. It's a pleasure to be here with you.
It is a pleasure. Thank you so much for joining us. You and I, we were chatting, and turns out we met each other a couple years ago.
That's right.
At the American Heart Association Social Determinants of Health Conference. I think that was in 2018. And look at us now chatting once again. So it is a very small world.
It is.
And so, can you share with our listening audience today this whole notion of health justice? Can you talk to us about that and how it's impacting your work with the vaccine?
Sure. So, the phrase health justice, the thing I like about it is that I feel like it has inherent in it a demand. Like, this isn't something we're asking for. This is something that is only just, only fair to get to a world where health is equal between peoples, and where we consider it unacceptable when that's not the case. So, clearly, as we think about COVID, we know that there have been very marked disparities in terms of who's gotten sick, who has ended up in the hospital, and who has died. And so as we think about the rollout of vaccine, we're very, very conscious of that and trying to figure out how we can reach the people who most need this vaccine, and do that in an equitable way.
That is wonderful, because when we talk about equity, I mean, there have been some stories on the news recently, for example, that a major hospital has admitted that after they, provided the vaccine to, the individuals in the hospital, the first responders and such, that they put a call out to their family and to their friends, right? And so there is a sense that folks who need the virus the most may not be getting it as quickly. Can you speak to that?
Yeah, and I think, as people roll out these vaccine programs, I think that there are some kind of course corrections that have needed to be made along the way. So either the vaccine for COVID, the two that initially came out before the Johnson & Johnson, which was just approved, are very challenging to work with. So once you have reconstituted vaccine, for example, for Pfizer, you can only use it for a few hours. So planning for using every dose is very tricky in a way that it isn't tricky for something like flu vaccine.
Okay.
Now, that doesn't mean planning shouldn't happen and that we should, that we should be distributing doses in a way that isn't equitable, but it does mean that people have to think in a very different way than has been done before. So I think that's starting to happen in terms of figuring out how do we get every dose into the arm of somebody who is eligible, and how do we prioritize people in the hardest hit groups. It's challenging, but it needs to happen.
Absolutely. I think, too, one of the things that I've been hearing in the community is that some folks don't even know that they're eligible. Can you speak to that a little bit?
Sure, yeah. And I think that getting the information out to people who are eligible is really, it's important and it's challenging because it's very complicated. So in Philadelphia, the rules are a little bit different than they are in the state. In the state, they're different than they are in terms of what the CDC is putting out. Philadelphia is much closer to the CDC, but they're different in each place, and I think that can add to confusion. And some of that comes from all of this being rolled out without a national plan initially, and I think we're all hopeful that it's going to get better with the new administration. But in Philadelphia, it's people who are 75 or over, people who are healthcare providers, people with chronic medical conditions, and people in those frontline service jobs that are most at risk. So, for example, food workers.
Right. Can you elaborate on what those chronic medical conditions are? Because that's where I think people are not as, let's say, not as informed as they could be.
Yeah, that's a great idea, and I think you're probably right. So our list of what we consider a high-risk medical condition, which is based on the CDC's list, includes cancer, chronic kidney disease, chronic obstructive pulmonary disease, or COPD, heart conditions, such as heart failure, coronary artery disease, or cardiomyopathies, an immunosuppressed state or weakened immune system, either from a solid organ transplant or from HIV. Here's a really common one: obesity or severe obesity, so a BMI of over 30, sickle cell disease, smoking, another unfortunately really common one, type 1 and type 2 diabetes, Down syndrome, and pregnancy. And one thing you'll notice is that a lot of people in Philadelphia have one or more of those conditions.
Exactly. That's the thing. That's the conversation that I've been having with people. I'm going to tell you something, Dr. Cheryl. Mostly everybody I know has something on this list, okay?
Right.
And let's just talk about that BMI, okay? So the BMI is a crazy chart to begin with. That's just me. That's not a medical opinion, everybody listening. I think the BMI chart, there's some controversy around it. Can anybody live up to that weight that's on there? I can't, but that's my own personal story. But what I want people to know is, again, what Dr. Cheryl said is so important. On the BMI, if it's, can you say the numbers again? It's between 30 and 40 is obese, right?
Yeah, I mean, for this purpose, all you need to know is that if your BMI is 30 or more, that would put you in that category of being eligible for the vaccine.
Exactly. And that's what we want people to know. Like I said at the top of the show, I have some health conditions. I won't talk about all of them. But I was talking to a friend of mine in the medical community, and he said to me, "Why haven't you gotten the vaccine?" And I said the same thing. I said, "Well, I thought you had to be a certain age and you had to be, you had to have these really severe health problems." I said, "I'll probably be in the last group." He said to me, "No, you're eligible." And I said, well, what do you mean? He said, "Please." He said, "I want us to be friends after this conversation. This is not me saying it." He said, this is the BMI. I said, "Uh-oh, what are you getting ready to tell me?" He said, "Well, Stacey, you're obese. You can do it." And I hung up on him. No, I didn't, Dr. Shaw. I'm just saying.
But you wanted to, right?
I really did. I was like, what? I've been working out. Don't just anyway. But I think that it just made a really valid point that more people are eligible than I think they even think, right? And so people hear about vaccination sites, or they hear about these events like the major one that Dr. Sanford did the other day with Black doctors. And some folks, I heard them say, well, I'm not eligible. It's no point in me even going. But certainly if they had this information, chances are that there was something on this list that might make them eligible.
Right. And I think, the big ones just for a lot of people, either smoking or that BMI of 30 or over. And just to give you an example, looking at the table for a woman who's 5'4", a BMI of 30 is 162.5 pounds. And a lot of women fall in that category.
Yeah, I might know one. I'm just saying. I'm just saying. I may know somebody in that category. I'm 5'2", by the way. Anyway, how can folks, Dr. Shaw, where can they go to get this information?
So we have a website, phila.gov/COVID, that has huge amounts of information about the virus, about vaccine, has a whole section on vaccine, and in there is a schedule of who is eligible. Now, there's a difference between eligible and having enough vaccine for everybody. Because as you've just pointed out, there's a lot of people in Philadelphia and across the country who are eligible and not that much vaccine yet. So being eligible is step one, but it's not the whole problem.
Right. And so folks have to, I've been seeing online a lot of these sites where you can sign up, right, or get on the list, and then you can be notified. There are a lot of those. And some of them are based on your zip code or, your healthcare provider and different things like that. Do you want to speak at all to that?
I do. So the Philadelphia Department of Public Health has a sign-up form. It doesn't directly give you an appointment, but it puts you on our list. And then we can send out a notice to you when you're able to sign up for an appointment. And the reason this is a really good time to do that is FEMA is coming to Philadelphia with 42,000 vaccines per week.
Oh, my goodness.
And that's a lot of vaccine. So,
and when is that happening? I'm sorry.
It's starting March 3rd.
Okay.
So this is a really great time to sign up. The vaccine interest form, people can simply find it by Googling, but you can get to it at COVID-vaccine-interest.phila, like Philadelphia.gov.
Mm-hmm.
And that is a place people can just sign up. They can let us know, what age group they fall in, what risk factors they have, and there's a checklist you can put in, contact information. If you don't have an email, that's fine. You can just leave that blank or put in a kind of dummy email address. And if you don't have a computer, you can call 311, and the city operators will sign you up.
Awesome. So, Dr. Shaw, can you give that website again for the interest form?
Yep. COVID-vaccine-interest.phila, like Philadelphia, .gov, G-O-V.
Okay.
And if you have trouble getting to it that way, if you Google Philadelphia vaccine interest form, you can sign up that way. And if you can't find it, 311 will get you there.
Okay. And so for more information about what Philadelphia is doing around COVID-19 relief, they can go to phila.gov/COVID.
Exactly.
All right. Well, Dr. Shaw, thank you so much. This information has been so helpful. We are going to post it on the Health Partners Foundation Facebook page. And so if folks have questions, this is where they should go to one of these two sites?
Yes, those sites. We also have our own call center for questions about COVID, which is at 215-685-5488. 215-685-5488, which is a Philadelphia COVID hotline. That's right.
Okay, Philip, I'm going to write that down. We'll post that as well, and we'll post links to your site on our site. So, Dr. Shaw, before we wrap up, is there anything else that you would like to share with our listening audience today?
Two things. Just first, thank you so much for helping to get this information out there. And the other is just for people to keep in mind, right now there's a shortage. We have about 400,000 people in our city who are eligible for vaccine. We're only getting about 25,000 doses per week. But as I just mentioned, we're about to get more. And so for all the people who are really frustrated right now and really scared, this vaccine is coming. We expect to get to everybody who's currently eligible by the end of April. And I know that's slower than we want it to be, but it's really around the corner. So we're almost there.
Well, thank you so much. Thank you for providing that encouraging message to us. You know, sometimes we listen to the news and we see what's going on, and there's a lot of negativity out there, and there's some scariness certainly around the virus and the vaccines and so forth. But it's so important to get the truth out, to get the facts out, so that we can continue to bring these numbers down, and so that we can keep everybody safe and try to get back to normal. So thank you so much. You have a great day, and thank you for joining us.
Thank you. Take care.
You too, take care. You too, Cheryl, take care. All right. So we are going to take a quick break. And on the other side, we're going to come back with Beverly Donaldson. And Beverly is the Executive Director of Neighbor to Neighbor. We'll be right back.
Celebrating Black history all day, every day. Medgar Evers.
All we want you to do is keep going with this fight for freedom. When we get this unity, ladies and gentlemen, nothing can stop us.
This is WURD Radio, 96.1 FM and 900 AM WURD. Philadelphia, independent Black media. You're listening to WURD Radio, 96.1 FM and 900 AM WURD. Independent Black media. In the community.
With Stacey Scott.
Presented by Health Partners Foundation. Right now. On WURD Radio.
96.1 FM.
And 900 AM WURD.
Streaming live on WURDradio.com.
And we are back. If you're just tuning in, you're listening to In the Community with Stacey Scott. We just wrapped up a conversation with Dr. Cheryl Bedigal, and she shared some really crucial information with us about the city's plans to roll out the vaccine. And one of the things I just really want to repeat is that if you have questions about your eligibility and your ability to access the vaccine, you can go to a couple of places. One, phila.gov/COVID, that's phila.gov/COVID. Or if you are interested in getting the vaccine, you can certainly fill out the COVID vaccine interest form. You want to go to COVID-vaccine-interest.phila.gov. And if you have some questions about your eligibility or your ability to access the vaccine, why not give the Philadelphia COVID hotline a call at 215-685-5488. And one of the great things that she said is, even if it's not available to you right now, please know that it is coming. The other thing that I'd like to repeat that Dr. Cheryl shared with us is that there are many things that may qualify you or make you eligible in this first round. So I'm going to read that list again, and we are going to post it on the website. And so persons aged 16 to 64 with high-risk conditions causing increased risk for severe disease. And here come those factors: cancer, chronic kidney disease, COPD, Down syndrome, heart condition, a weakened immune system, obesity. Whether your BMI is 30 or higher, you are eligible. Pregnancy, sickle cell disease, smoking, type 1 diabetes, type 2 diabetes. And I'm sure that you know someone in your family or someone close to you that has maybe one or more of these conditions. And so that automatically makes them eligible for the vaccine. So certainly if that's something that they're interested in doing, please encourage them to sign up and get the vaccine. And so next, our last guest today, we saved the best for last. We're going to have a quick conversation with my dear friend, Beverly Donaldson. And Beverly is the executive director of the Neighbor to Neighbor CDC. And Beverly says that growing up, her house was the place where everybody came for Sunday dinners or anything else that they may have needed. And we all know that house in the community, right? So she says home is where her service to others began. She completed her undergraduate degree in organizational management and a graduate degree in nonprofit management at Eastern University. In 1985, she joined the First African Baptist Church, and then later on, she was asked to take on the position of executive director of Neighbor to Neighbor CDC, established as the nonprofit arm of the church. Beverly says that, you know, there's a quote that says, "Choose a job you love, and you will never work a day in your life." And she certainly feels that way. And I will tell you, I work with her on many, many projects, and she certainly is a joy to work with. Beverly, are you there?
Yes, I am, Stacy.
Hey, Miss Beverly, how are you?
I'm doing well. How are you?
I'm good. I'm good.
And thank you so much for inviting me on today. Your show has been great.
Well, thank you. Thank you. Thank you. And thank you for taking time out of your Sunday evening to join us. We're talking about all things COVID-19 vaccine related. And I personally know that you held a vaccine clinic over there at Neighbor to Neighbor. And why don't you talk to us about it?
Well, I was approached by Divine Province Village, a nonprofit over in Springfield. They said that they had vaccines to give out to the Black and brown community, and they wanted to know if we were interested. And at first, I kind of thought, well, I don't know if I'm going to be able to get enough people to come out. They told me they had 50 vaccines. I sent an email out on a Thursday evening after 5 o'clock, and by Friday noon, I had over 150 people wanting to sign up for the vaccine.
Wow.
Yeah.
Wow. And so, again, that goes directly to that narrative that we don't want to get it, right?
Yes, yes. You're absolutely right. You're absolutely right. And I was one of those. I said, we're not going to be able to get 50 people. And my phone is still ringing off the hook. I'm waiting now for confirmation for another clinic for the first vaccine, and we have over 200 people on our list now.
Wow. And I can testify to that because I called you at the office the other day, and now that's what your voicemail says, right?
It doesn't matter. They're still calling. But we'll take them, we'll take them. And if they're willing to go on the list, we put them on the list.
That is wonderful. And so, again, by way of personal testimony, I was able to get my shot at your clinic, at your vaccine clinic. So thank you to you, and thank you to the folks at Divine Providence Village. Give them a shout out. I'm scheduled to get my second shot with you all next week, so you'll see me there.
That's right.
And one of the things that was very, I think, encouraging to me when I went, and thank you because you all followed all the, the protocols, and we were socially distant and all of those things. So thank you for that. Just the sheer number, again, of Black and brown folks who showed up, right? And again, I think it's so important that we continue to spread that narrative that, yes, while there is some hesitancy in our community, by and large, people are interested. People want to get the shot. And so folks are showing up. I know that after you did the first clinic, did you do another one?
Yes, we did a second clinic on February 10th.
Okay.
And that was for the first. That was for the first vaccine.
Okay. And about how many folks were vaccinated that day?
We did 150 on that day.
150. So the first one was 50.
Mm-hmm. First
All
one
right,
was
and then you did another 150.
And then we did 150.
Wow.
Yeah. So they will be coming back.
That is so wonderful.
They will be coming back on March 10th to get their second dose.
Okay.
Mm-hmm.
Well, we so appreciate all that you're doing. Why don't you tell us about some of the work that Neighbor to Neighbor does?
Well, at this time, Neighbor to Neighbor is a community organization, and we're just about doing things for the community, helping the community. Right now, what we're doing because of COVID, a lot of our programs have been cut, but we do have an emergency food cupboard, which is open to Delaware County residents every Thursday evening from 6 until 8 p.m. And not only do we give out food, we give out other essential items. We got a couple of grants that we were able to purchase paper goods, paper supplies, diapers, baby diapers, wipes, things of that nature to give to the folks that attend the emergency food cupboard. So we have that, and then
Wonderful.
we are an authorized testing center. With Pearson VUE, we administer about 135 different certifications and testing. So those are the two main programs that we're handling right now during the COVID.
Okay. So with your food pantry, that's every Thursday from 6 to 8 p.m. for Delaware County residents. So if someone was to show up, what do they need to do? Do they need to show their ID or proof of income, or how does that work?
Well, we don't ask for proof of income. We do ask for photo ID. At these times, everybody is in need. So we think if you're standing in line waiting for food, then you probably need that food. So as long as you have a photo ID with your current address, which would be in Delaware County, you're welcome to come in.
Okay, current address. And we will also post this information on the Health Partners Foundation website. We'll also include a link to your organization. But I think that is just so wonderful. So again, it's not just food, but it's also paper goods, diapers, and wipes, did you say?
Yes. Mm-hmm. Yes.
Okay, wonderful. And then, Ms. Beverly, whatever we can do at the foundation to help support your efforts, we are more than happy to do that. So let's you and I have a conversation offline about how we can support this effort as well.
Yes, and Health Partners has always come through for Neighbor to Neighbor. I really appreciate you, Stacy, and all of the other people that work with us from Health Partners.
Well, it is certainly our pleasure. Tell me a little bit more about this authorized testing center. What is that? What are you doing? What kind of testing?
So the tests run from GED to IT certifications, teaching certifications, people taking their real estate licensing, anything that you would need a certification for. You register at Pearson VUE, and then you come to our site and our secure test center. You take the test there. And we're open Tuesday, Wednesday, and Thursday from 10 until 4 in the test center.
Okay.
So Tuesday, you just go on Pearson VUE. Yeah, you just go on Pearson VUE website and choose our location, and you can register for the test.
Wonderful. And why don't you let everyone know where you are located?
We are located at 814 Clifton Avenue in Sharon Hill, Pennsylvania, which is also Darby Township.
Right.
I'm not from that area, but when you say Sharon Hill, the folks out there tell you, no, they're in Darby Township. So Sharon Hill / Darby Township.
You are correct. That's what folks say. They are very specific about that, because I have heard that as well. About how many folks, when they come out to this testing, I'm sure you're following all the protocols in terms of being safe and socially distant and things like that. About how many folks would you say, have received their certification through the partnership with Neighbor to Neighbor and Pearson VUE?
Well, we've been testing now for, I guess, about 6 years, and maybe about, I guess we do about 1,000 people per year.
Wow.
That will come through and do testing, yes. And we are socially distanced. We have our test center we only use half capacity, which is, I think we have 8 test stations. So that's what we use, because of the COVID. And we're being socially distanced. You have to wear your mask, and we're cleaning up. As soon as someone leaves a computer, we clean that computer off. We sanitize the computer, make sure it's clean for the next person. So
that's wonderful. You do so much for the community, Ms. Bev, and it's such a pleasure to work with you. It's such a pleasure to know you. We've known each other now for a couple of years. I remember the first time I came out, I got lost.
Yeah.
I could not find that building. I said, where is this woman? I can't find her. It was crazy.
Yes, it was
but
crazy.
Since that time, we've been able, but I'm so glad I was able to get turned around and to find you and to be able to do some of the great things that we've been able to do together. I'm sure we're going to do even more as the years go on. Is there anything else that you would like to tell our listeners about Neighbor to Neighbor CDC?
Well, Neighbor to Neighbor is a small nonprofit. We've been around since 1994, but we do such great things. We really do. And, we don't do it with a lot of fanfare, but we also have a lot of people like health partners to help us out to do the things that we're doing. And I really wouldn't have it any other way.
Well, thank you very much for all that you do in the community. We're so happy to partner with you. Thank you so much for spending your Sunday afternoon with us today. And
Yes,
I'll be chatting with you soon. And I'll see you on Wednesday.
Yes. And thank you so much for having me, Stacey.
All right. Take care, Miss Beverly.
Okay. Bye.
Bye-bye. All right, family. I tell you, the hour goes by so fast, Mike. Where does it go?
Man, I'm trying to figure that out every day.
Goes by so
You
fast.
only need 3 hours.
Well, listen, from your lips to God's ears, let's just say that.
To existence. There you go.
There you go. And so, family, it's been such a great afternoon as always with you. So let's do a quick recap. So today we talked to Dr. Merlene Harris-Williams from Health Partners Plans, who talked to us about all the things that HPP is doing to keep the members safe. I shared with you some information about the Health Partners Plan CHIP program. Certainly, if you know someone who has uninsured children that are not eligible for Medicaid or Medicaid, give us a call at 888-888-1211. We also spoke with Dr. Cheryl Bedigal, Director of the Division of Chronic Disease and Injury Prevention for the City of Philadelphia. She gave us some great resources. Remember, check out those links. You or someone you know is probably eligible to receive the vaccine. So we want you to be safe and we want you to take care of yourself. So if you have any questions, you can go to phila.gov/COVID. If you are interested in getting the vaccine, you can fill out the Philadelphia Vaccine Interest Form at covid-vaccine-interest.phila.gov, or you can call the COVID hotline at 215-685-5488. And then we wrapped up the show with a conversation with my good friend, Beverly Donaldson, who is the executive director of the Neighbor to Neighbor CDC. They've already vaccinated some 200 folks, and she's going to continue that effort. And so we want to praise her and her organization, as well as the Divine Providence Village, which is the organization that's coming out and doing the testing. So as always, family, as we wrap things up on this rainy Sunday afternoon, I'd like to share a passage with you from the 3rd of John, and it says, "Beloved one, I pray that in all things you continue to prosper and enjoy good health as you are now prospering." Thank you so much for listening to the show. Please, let's practice kindness and goodness. I'm Stacey Scott, and I'll chat with you again next month. Take care.
Close my eyes and thought of us in different ways. I'm getting there so to say.